with the rise in weight loss medications, Ozempic, Wegovy, Mounjaro, all those ones, it's causing aesthetic issues within men and women, but mainly the men are on the rise with skin sagginess. Breast surgeon, associate professor Sanjay Warrior, also Sanjay is from the Chris O'Brien Life House, joins me now. Hello, Sanjay. Thank you so much for your time.
Oh, thanks for having us on. Really appreciate it.
So what are men asking for in relation to skin surgery? What are they coming to you for?
Yeah, with the weight loss medications, they can lose between 10 and 40 kilos, but what they can do ultimately is lead to a loss of weight without the associated loss of skin. Sometimes it adjusts, but sometimes the elasticity of the skin's not there and you end up with wrinkly skin, and that can basically impact these people who have set aesthetic goals. Sometimes it's functional, but sometimes they are concerned about the way it looks, and it can be debilitating for them psychologically. So
is it mainly, because you do mainly breast surgery, but are they coming to you for other, are you having to refer them on for stomach and things like that?
Yeah, I tend to refer on for other bits, but if it's a breast-related issue, and we see it in both males and females, where basically having to revise the skin. Sometimes the other bit is that with the glandular tissue, sometimes you're unmasking gynecomastia, which is glandular tissue that doesn't go when they lose weight, and that needs to be potentially resected as well at the same time.
And does, in the skin in general and in that area as well, does men's skin bounce back better than women's, or does they lose the same elasticity?
Yeah, it's a tough one because there is a group that we won't be seeing that definitely will just be bouncing back, like you said. Ultimately, probably it's dependent more probably on the way that the patient is or the person is like how much weight they're losing, and ultimately, when you're losing a lot, ultimately it can lead to a lot of wrinkliness there.
Is there an age where the skin starts losing elasticity and then doesn't bounce back at all?
To be honest, it definitely, there's no doubt that weight loss leads to a loss of skin, elasticity and ability to bounce back. And sometimes having that fuller look, it's easier. But generally, as you get older, that elasticity reduces, and we definitely, the older the person, the more likely it is that the skin won't accommodate when you lose the weight. And we see that in not just in the breast, in other areas of the body.
It's not all what we want to hear, but that's what you're here for. Chatting to Sanjay Warrier, Associate Professor, leading breast cancer surgeon at Chris O'Brien Lifehouse. So the procedures, because it's not as archaic as what it used to be, is it quite say, if you're a man or a woman and want to have the skin in your breast fixed, talk us through that. How long does it take? What's the bounce back process?
Yeah, it's not too bad. It's an area of the body that, compared to the belly, like if you've had your appendix out, particularly in the old days when we used to do open procedures, that's a lot more tender compared to necessarily the upper body. And obviously it's variable depending on the person, but what we're effectively doing is refashioning the skin, bringing the nipples in the appropriate position, and also for the males, we're potentially looking at removing the glandular tissue, which we call gynecomastia. Potentially, some of them require some contour work as well in terms of liposuction in the areas. But with the females that you've mentioned as well, like it's not uncommon to have patients that lose weight and then have what we call ptosis, which is drooping of the breast. And with that, they need a refashioning of their breast tissue with the idea of getting the nipple higher, resecting the skin and making it nice and neat and giving them confidence again. And that with that procedure, generally, it can take varying amount of time, but generally in this instance, I think it's reasonable to say 2 hours to do the procedure. It might be a little bit less, might be a little bit more, and then from there you're looking at a couple of weeks of recovery, hopefully getting back to activity following that, but trying to avoid upper body heavy lifting for that first 2 weeks.
So can you go home that same day, or is that just dependent on the patient and their history?
Yeah, it depends on how motivated they are. We tend to keep them a day, but you could definitely, I think, particularly it's just them getting comfortable. Sometimes we're putting drains in. There are fancy dressings we are using these days to make the recovery better and for the wounds to heal better. So it generally tends to be an overnight stay. I tend to do it that way, but I don't think it's unreasonable if other colleagues are doing it day only as well. So,
Professor, can some of these procedures be claimed through Medicare? Because obviously in that, can it be unsafe to have that much skin in the breast area?
No, it's not. It's not that it's unsafe, but it can psychologically impact patients, I think, where they're going to all this effort to, for health reasons, for other reasons, to potentially lose weight, and then suddenly they've got skin that's really, deforming for them and aesthetically unpleasing for them. I think it is something that really can impact them mentally significantly. But it's not something that we would consider a cancer risk or etc.
So,
but
Sorry. No, you go.
No, yeah, just basically, I think with that, I think it's working with the hospitals to see what's appropriate, and varying jurisdictions might have varying ideas on whether to take it on. I tend to do more of this work privately because there's high expectations as well relating to outcomes. So it's not something personally, I tend to like to do it myself, sort of, and it's just a personal approach because I think at the end of the day, I'm trying to get a good outcome for that patient.
Yeah, I'm just trying to sort of figure out what's the sort of most cost-effective way for people to do it, whether you can do it on extras or private health or something like that. But
definitely private health would cover it. Yeah, I think, but it's ultimately, I found this is just my personal experience. I've found I've sort of like to do it myself just because I think it takes a degree of skill set to be doing it, and it's something, even if we were offering it publicly, I would say I would advise surgeons to be heavily involved with it.
Sanjay, if people want to get in touch with you, what's the best way to do that?
Yeah, probably the best is through my website, which is Sanjay Warrior, Sanjay at drsanjaywarrior.com. And really happy to see patients that are having issues with gynecomastia or needing lifts, particularly, or needing these sort of procedures.
Yeah, it's good to have the conversation, isn't it? To see. Yeah,
definitely. I think the big thing is I think there was a lot of taboo, even talking about gynecomastia surgery and associations. It has to be that someone's on steroids or other associations with it, but it is something that happens. And end of the day, it's just making sure you're comfortable with your own body, and if it's going to make you happier and make you feel better, I think it's worth taking it on and understanding the risk. But if it's not bothering you, it's reasonable to leave it. But if it is bothering you, please seek medical attention.
All right, so it's drsanjaywarrior.com.au for further information. Associate Professor Sanjay Warrier, thank you so much and best wishes.